Hi, everybody. Let's go ahead and dive into the case of Peggy Sims. Looks like she was first evaluated for admission to an inpatient eating disorders program. So, right off the bat, here we have kind of a key of where the scenario is going, just for the fact that there was an admission to an eating disorders program. That's pretty specific at this point. So, let's figure out kind of what went on and if we can look at what diagnosis is most appropriate and or diagnoses, depending on what comes out of this. So it looks like she was 20 years old, had difficulty supporting her 5'3" body with a weight of only 67 pounds. Now, in the little bit of research that I did online, which take it or leave it, at a height of 5'3", typically that would need to be, from my research, somewhere between 107 through 135 as far as pounds. So that gives you maybe a little bit of perspective that at this point in time she was only 67 pounds. So that's significantly below weight. We're approaching, if my math is correct, we're about 40 pounds below weight at this point. So I'll just put a negative 40 pounds at this point. She's down to 67. That's really low. So let's continue on. It looks like she had begun to lose weight 4 years earlier, initially dieting to lose an unwanted 6 pounds, which I think this is kind of how the ball gets rolling. There's an initial kind of weight loss going on, 6 pounds. And then here's this interesting kind of positive reinforcement. She was encouraged by compliments on her new body, which is great, right? When somebody loses a little bit of weight, certainly the compliments roll in, especially nowadays. You get social media, whatever, and you get a lot of support, which can be great. And yet this can also kind of get things going down a path that can almost kind of go out of control depending on how this person begins to interpret that. So at this point, it looks like, after the compliments, she proceeds then to lose 8 more pounds. So now we're, 14 pounds down. And then over the next 2 years, she continues to lose weight while increasing physical activity. So here we have a couple of things going on, which is can be pretty typical with folks that are, if we start to kind of rule out or start to kind of go down the path of kind of differential diagnosis, certainly the losing weight is looking at an issue as far as eating disorders. We're looking at anorexia, and we could, obviously begin to at least throw in the idea that there may be some sort of bulimia there, but let's check it out. So she increases her physical activity, which again, as I said, is pretty common, in order to then achieve a higher level of or increased level of weight loss. So this in fact did occur to the point where her weight loss reached a low of 64 pounds. So if we look at that, that's really, really low. That's incredibly low. I'm no doctor, but when we're now below 40 pounds below weight, things are pretty scary. In fact, it looks like she stopped menstruating at that point because of the impact on her body, which as a clinician, everybody, definitely these are cases, eating disorders are ones that from a clinical perspective, you will definitely want to work in conjunction with a medical provider. So I'll just put that down here. You want a medical provider on board if you start to meet criteria for a possible eating disorder. Let's get a medical provider on board so that they can take, the reins as far as the medical issues, understanding what's going on physically, the weight loss, the nutrition, all of that stuff. So we want this, we need a referral to a medical provider proceeding at this point. So it looks like indeed she was admitted to a medical unit because of this. She was treated for an ulcer, peptic ulcer disease and then discharged, which seems to me obviously pretty premature. She admits her, treats for peptic ulcer, and then discharges her. Obviously, that was not sufficient. I would have thought that this would be pretty textbook for them to say, nope, something's going on. But we find out then that only 3 months later, then she was admitted to a psychiatric unit of a general hospital, which probably should have been their first step 3 months earlier. Nonetheless, we're at this point now. So during that 8-week hospitalization, her weight increased from 84 to 100. So we're definitely now going in the right direction as she put on, she reached a low of 64. She's increased between 84 and 100. So we're back up over 20 pounds, which is excellent. We're headed right back where we need to be going. She was doing well till she went off to college, where with increased academic and social demands, she began to diet until she reached a weight only 67 pounds. So here we go. We kind of plummet back down, significant weight loss once again. And it looks like she reports that she'd become troubled by changes in her body when she was heavier. So here we have some of the criteria then that will help us begin to look at the eating disorder that's in place. So one of the first things here of the criteria is she's troubled by changes in her body when she was heavier. So that's becoming troubled by changes in her body when she was heavier. That is certainly meeting some criteria. Okay. For an eating disorder, particularly anorexia. Then she becomes increasingly anxious about her figure as she develops. So we're also looking kind of, again, with similar criteria. So increased about her figure. So increased by troubled in the change of her body as well as anxious about her figure. So here we're meeting kind of criteria for an eating disorder. Her eating habits were such that were ritualized. She cut food into very small pieces, moved them around the plate, ate very slowly. She resisted eating foods, so there's some kind of restriction in the eating. Foods with high fat, carbohydrate content. She was forced to drop out of school and accept another hospitalization. So we see that this is impacting various aspects of her life, which is also typically required with a mental health disorder. It's not just impacting one area, but now it's significantly impacting multiple areas. So Peggy was motivated to comply with treatment, but her fears of gaining weight and becoming obese affected her progress. So I'm going to highlight that once again. So we have fears of gaining weight and becoming obese. I'm just going to underline this again. This idea of becoming obese is also very key, because at this point we can barely even approach kind of normal, the low end of normal weight, and yet this unrealistic kind of fear of becoming obese, and the way she labels it of becoming obese, is so far out of range at this point. But to her, the word obese and that seems completely within her rational thought, and yet to everybody else, including probably us as clinicians, the word obese is not even in the ballpark of what we're worried about at this point. But that also kind of is meeting part of the criteria as well, is kind of this distortion about her thoughts of gaining weight and body image as compared to what she's really at right now. So she was expected to gain a minimum of 2 pounds a week. She was restricted to bed rest if she failed to gain that weight. In therapy, Peggy was gradually guided to discuss her feelings and to actually look at herself in the mirror. She was initially instructed to look at one part of her body for a minimum of 10 seconds. And at the time, she progressively increased until she could look at the whole body without anxiety. Her menses returned at a weight of 93 pounds. So that's great. She starts heading back in the right direction. She's headed upwards once again. So let's finish out the rest of this scenario and kind of see how things turn out. We can see at this point, though, before we go on, we don't see any, let me just write this down. We don't see any purging issues at this point. So as far as kind of specifiers and as far as looking at possibly bulimia, we're really not looking at a purging issue at this point. It's mostly restriction of food, kind of increased exercise and increased ways to decrease her weight and fears of gaining weight. So the purging is out, and the binging, again, so I'll write that as well. Kind of this idea of binging and purging is so far not in this scenario. So let's take a look at this next part and see how things go. All right, everybody. So after 7 months, after 7 months, she has individual and family treatment, which is certainly appropriate to have both. It's going to be a team effort to get the support needed and to help Peggy, this individual, out as she attempts to really overcome this, what can be a very, very difficult mental health issue, as well as the physical side of it. So individual family treatment, looks like she was discharged at the weight of 100 pounds. So certainly she's back on the right track and headed towards becoming back to a healthy weight. She's a little underweight still, but back near to where she should be. So it looks like she returns to college, worked part-time, and lived with her parents. So she's making a comeback from what was kind of a devastating, kind of very difficult period in her life. And it looks like over the next 10 years, she graduates from college. So I'm going to highlight this a little bit differently, just for the fact there's some environmental resiliency factors as well as some different environmental issues. So good for her. She graduates with a degree from college in nutrition, of all things, which good for her. She'll be able to definitely speak to the importance of nutrition, and was selected to do an internship with a major corporation. So a lot of resiliency factors there. She excelled in her work, receiving several promotions. So she really has made a comeback in her life. She married, but the relationship deteriorated as her husband became physically abusive. So certainly things turned around, which could, kind of given different histories, could be susceptible to have a stressor kind of send her in the wrong direction, not necessarily back into anorexia, but this could definitely be a stressor that could cause some issues. She moved out, obtained a court order, protective order, eventually divorced. However, it looks like her most recent correspondence told of a return to graduate school. So cool, good for her. That's great. She returns to graduate school, looks like full ride scholarship. Starts a new romance, success in a marathon, which again, way to go for her. Maintains a weight around 116 pounds, which is certainly now within kind of probably at this point well within the kind of normal range, or where she at least should be. She menstruates normally, so physically it looks like her body has returned to some normality at this point. She did seek counseling to sort out issues related to her broken marriage, so that stressor obviously did impact her life and what it did. Obviously, DV, domestic violence involved. It looks like she was also estranged from her sister, but that was resolved. So she describes her life now as full and satisfying. So it's kind of interesting. This scenario kind of made this full progression. So let's talk about that. Returning to the first part of the scenario, we are looking at this point, the first portion of a diagnosis of likely anorexia nervosa, which according to the DSM, right next to me, F50.01, and in this case it was restricting type and not the binge eating purging type. there was only restriction. Just to go over the criteria really quick, we did see a restriction of energy intake and nutrition requirements leading to a significant low body weight. So we saw criteria A met. Criteria B, there was intense fear of gaining weight or becoming fat or persistent behavior that interferes with weight gain. So yes, we saw that anxiety and fear of gaining weight. And then finally, criteria C, which there was a disturbance in the way one views body weight or shape, the way their shape is experienced, an undue influence of body weight or shape on self-evaluation, and or the persistent lack of recognition of the seriousness of the current body weight. So we saw her, again, fear of becoming obese and her shape as she became heavier, even though her weight was significantly below that of a normal weight given her body size and height. She still was concerned about her body shape. So criteria C was met. So if we look at the first part of the scenario, certainly this is an individual. This would be kind of somewhat of a classic case of anxiety nervosa, restricting type. That would be an appropriate diagnosis at the beginning. Now, we have this interesting change towards the end, that after 7 months of treatment, she was discharged at a weight of 100 pounds and she returned to college, started working full time. So at that point, it's interesting, kind of afterwards, we almost have this idea of a partial, what I would at least call partial remission after about 7 months. That's how I would consider it. So it's like she starts off with anxiety or anorexia nervosa, kind of the full criteria. Then it kind of goes into partial remission after 7 months. And then we have over the next, several years, and I'll just do this in a different color, we really kind of go into full remission, where there was more of a significant amount of time. Significant time passing to where she did not meet the criteria, or at least there's no indication. So we have this evolution, which is kind of a cool scenario. We have an evolution where if you were the clinician early on, she definitely would have met the criteria. Then there's this after treatment, likely after 7 months, she was discharged, things were going well. It doesn't look like any reoccurrence. So the diagnosis would have evolved to partial remission. And then after several years, or even I'd say probably after a year or two, if there was no other symptoms going on, we could have a full remission as a specifier. So that's really kind of neat to see in a scenario where there is this evolution. It does still fall under the F50.01 because it was a restricting type. There was no binging and purging going on, so we have that. As far as the severity, back when she was with the full criteria, it talks in the DSM about a body mass index, the BMI, of mild, moderate, severe, extreme. I typically leave that up to the medical provider to then provide me with, or have a release of information to be able to communicate and just figure out from them what they determine to be the body mass index and whether it's mild, moderate, severe. I just turn that stuff over to the medical provider, get their information, and include that in the diagnosis just to kind of do the specifier, whether in her case it would likely be severe or extreme, at least in my perspective, being over 40 pounds below the weight back when it was at its worst would likely be severe or extreme for sure. But again, that's a medical provider stuff, so I would leave that to them. But just make sure you're in communication with the medical provider throughout this whole process. This is also an area, as far as eating disorders, anorexia, and bulimia, something you definitely want to get trained on. Seek consultation if you are working with even a mild end case. Very specialized. I typically refer out in these cases where it is progressing towards that point where I think this diagnosis, anorexia or bulimia, is going to be the diagnosis. This is something that, as I said, you want experience or training in because of the dynamics involved with the medical provider, the nutrition, as well as some of the other mental health components involved. So this is the case of Peggy, anorexia nervosa, and really kind of the evolution to the point of full remission. So really cool. Thanks.